Becky Thorson with an update from Windom Area Health, and today I'm chatting with Wendy Wenner, Cardiac Rehabilitation Coordinator at Windom Area Health. Hi, Wendy.
Hi, Becky.
What is cardiac rehab?
Well, cardiac rehab is a combination of services that help patients with cardiovascular disease improve their functional ability, particularly their tolerance to exercise. And in cardiac rehab, the patients have the opportunity to collaborate with physicians, nurses, dietitians, diabetic educators to achieve as well as maintain optimal health.
What kind of things do you do in cardiac rehab?
Well, in the cardiac rehab program, we help patients regain strength after a heart surgery or a diagnosis of heart disease. A specialist will monitor the patient's heart rate and rhythm and blood pressure and other important vital signs. We also design an exercise program to rebuild heart muscle and strengthen the heart, helping patients resume their activities of daily living.
So what are some of the risk factors?
Some of the risk factors of heart disease include smoking, diabetes, high cholesterol levels, obesity, high blood pressure, and stress.
Are you able to reduce any of these risk factors to help prevent future events?
The cardiac rehab staff will work with patients and set individual goals to reduce these risk factors and help prevent any further heart events.
And who is eligible for cardiac rehab?
Eligibility are patients with a myocardial infarction, which is a heart attack in lay terms, a patient that has gone through PCI, which means percutaneous coronary intervention, and in lay terms is angioplasty with stents, a coronary artery bypass grafting, valve replacement or repair, chronic stable angina, and severe heart failure are all patients that are eligible to be in the cardiac rehab program.
So does this service require a referral then?
Yes, it does. A physician's referral is required for cardiac rehab, and you should contact your provider if you think you're a candidate.
How long is a cardiac rehab program?
Well, the duration of the cardiac rehab visits vary with each patient from 12 sessions to 36 sessions, depending on the patient's insurance. The patients typically attend cardiac rehab 3 times a week, Monday, Wednesdays, and Fridays, at a set time, and these sessions usually last about 45 to 60 minutes.
And what are the benefits of cardiac rehab?
Well, the benefits to cardiac rehab include strengthen the heart muscle and make it pump more efficiently, control heart disease risk factors. Patients that enter the cardiac rehab program, usually they've done studies and they live longer and lessen their chance for another cardiac event. It also decreases physical and emotional effects of heart disease, and they have the opportunity to meet and share stories with patients just like themselves. And it also improves patients' confidence to continue exercising and maintain heart-healthy lifestyle.
And so if someone wanted to contact you, how do they go about that?
Sure. For more information on cardiac rehab services here at Windom Area Health, you can call us 507-831-2400 or check out our website at windomareahealth.org, and be sure to follow us on Facebook.
All right. Thank you so much, Wendy, for all that helpful information.
Thank you, Becky.
There's Wendy Wenner, Cardiac Rehabilitation Coordinator at Windom Area Health. Visit windomareahealth.org.